So basically, welcome all. Uh, Astute, we started our operation in 27, 28 years back in the from Pune, and Dr. Tushar Devras, he's a founder director of this academy, and now we have an international presence. We have our own office in Chicago. Cogent Edutech Incorporation is our US concern right now. And basically, we are a group of academicians. We don't represent any of the universities. We don't believe on commission business. And we are totally student-centric academy. So basically, uh, every medical professional has the focus to become a good doctor, actually. Quality of education matters, clinical exposure matters. Without post graduation, now survival in the medical profession is very, very difficult. It is a need of an hour to have a specialization. Every doctor has a dream to pursue certain specialization of his interest. Uh, and in the world medical education scenario, India has its own place. We have a best of the doctors, clinical practices. Our clinical diagnosis is very, very strong for Indian doctors. We are very good in communication and hard work also. Basically, United States of America, United Kingdom, Australia, New Zealand, and Canada. These are the biggest economies in the world with best of the education systems, best of the research available. And so so mostly, basically, the education from United States, UK, Australia, New Zealand, and Canada, it is a globally accepted education. So uh, basically, this webinar which I am conducting, it is to share certain information with all the candidates who are having a dream to go to the United States and pursue their higher education, medical PG programs from US. And basically, as we are a US corporation, we have our center in Chicago. Everybody, please keep yourself muted, please. And we can ask the questions. Kirti,
463386.
yeah.
463386.
Varsha, please mute yourself. So, as we are a US corporation with the best of the academicians, we have accredited residency hospitals in the Vineland, New Jersey area in the United States with a team of doctors. And we know the complete in and out of the residency admissions. What is the pattern? What are the new changes in the system? What are the new regulations by the US government in the US for the medical PG? Globally, what are the changes happening post COVID? So a lot of changes are there. And since we have a very great team of experienced faculties and having a strategic and analytic approach, our specialization is in the strategic and analytical approach in the education. So basically, we are in the best position to guide the student to get their admits in the residency, and we guide the student for the complete process, right from his evaluation of his profile and till the PG education, till the admits in the United States, in India, in most of the countries. So our basic ethos of the company is that we believe that quality education and successful career is the fundamental right of every student. So irrespective of his financial condition or irrespective of his academic credentials, we firmly believe that he can have a great career, he can have a great quality education, and for that we are putting our 100% effort since years. So it is just I am sharing our credentials. We have received a lot of national and international awards. We have got Champions of Change Award at the hands of then Vice President of India, Shri Venkaiah Naidu. This was a very, very prestigious award as it was given by the Niti Aayog Planning Commission of India. We have got Pride of Nation Award at the hands of Honorable Defense Minister of India, Shri Rajnath Singh Ji. We have received a Corporate Social Responsibility Journal Excellence Award at the hands of then Chief Minister of Maharashtra, Shri Devendraji Fadnavis. Maharashtra Gaurav Award at the hands of Honorable Minister of Transport for India, Shri Nitinji Gadkari. Uttar Maharashtra Ratna Puraskar. This was a very, very special award given to us alongside Swargiya Lata Mangeshkar ji and Pratham Mahila Rashtrapati of India, Shri Pratibha Patil. So, very, very prestigious award. More than 45 awards. We have been felicitated in the UK Parliament also, House of Lords. That was a great moment for us. I have got a Mayor's Innovation Award at Nagpur. Again, I have received International Iconic Achievers Award in Moscow, Russia. And I have been chosen as a Best Career Counselor in Maharashtra by Eminent Research Foundation. So, more than 45, 50 awards. So, all these awards are not about just sharing. It is all about inspiration to work in a more positive manner for the welfare of the students. To contribute in the nation building um, that is there. So, as I shared with you, we are a group of academicians. So, very proud to tell you that Dr. Donald C. Martin, who is the ex-dean of Columbia University, it is a Ivy League university, ex-dean of Booth School of Management, University of Chicago. So, he's our director there. Ranali, please keep a watch and please, as you are a co-host, you can mute everybody.
Yes,
Please,
sir.
please. So, basically, more than 45 years of experience now. He's almost 68. And for 14 years, he was the admission dean for Ivy League University, Columbia University. Evaluated more than 150,000 applications. So, great team. And hence, we have a very, very experienced team, and we are always guiding the student for next 10 years of time. What are the changes happening, and what are the new careers, what are the new options available for the students, what can be the best possible solution for all your problems, how to choose a proper career, what can be the strategy for residency admissions. So, in and out completely, very, very experienced team. Now, in brief, for some participants, I will be covering the Indian admission scenario. Lot of students are there into the final year of MBBS or second, third year of MBBS. So basically, in India, government institutions are there, and 50% of the quota in the institutions in the government institution is for the central all India quota, and 50% of the quota is for the state government colleges, and both have their own reservation policies. So 66% of the reservation is there in the center, and in Maharashtra this year around 72% reservation will be there if the Maratha quota is allowed. So basically, then in the central institutes are there. There are four types of institutes. Government. Then second is the Central Act colleges like AIMS, Zipmer, Armed Force Medical Colleges, and all that. Private institutions in the state, and fourth is the deemed universities. So every state has its own counseling process. Hello, please keep yourself muted. Hello. Yeah. So every state has their own policies. Every state has their own counseling authority. So distribution of seats in the PG seats, there are around 32 specializations. So every state is distributing the seats as per their policies, and the reservation policies are also decided by the state authorities. So many of the states have non-domicile quota for the PG admissions in the private institutions also. So the student can apply for the 50% of all India quota, 50% of the state quota, plus he can apply to the such states where in the private institutions where non-domicile quota is there, like Karnataka, Uttar Pradesh, lot of states are there where some seats are reserved for the all India quota or non-domicile quota in the private institutions also. But there the reservation will not be applicable for you, and no domicile is required for all the states. For as far as Maharashtra, Gujarat, Orissa is concerned, they require the domicile. non-domicile students cannot apply to these states for the private institutions and all that. So, as compared to the MBBS, and deemed universities have the centralized admission process, and it is handled by the medical counseling committee. As far as and second round in the deemed universities is very crucial at the all India level. Second and third rounds are very crucial now, as far as the admissions are concerned. So now, if you are getting the seat in the second round or third round in the medical institution, so you will not be eligible for central mock or straight rounds in the state also. Vice versa, this is there. The central will be distributing the exchanging the list of eligible candidates with the state, and similarly, the states will be giving the list to the central authorities. So second and third round policies are very crucial if you want to get the admissions in India. Uh, the biggest problem in India is the number of seats available. So this year around 70,000 PG seats are there, and around 2.6 lakh students will be appearing for the NEET PG examination with only 70,000 seats, and across the 32 specialization, clinical and non-clinical specializations, postgraduate diplomas also. So number of seat for each specialty is specialization is very less. I remember in 2018-19 for general surgery and as well as for the dermatology, there was no seat available in Maharashtra for the open category candidate in the government institution. And the cost of education in India, if you are not going to basically to the government institutions, if you are not getting the admits, which is the chances are very low per category. So the cost is between 50 lakhs to 2.5 crore rupees to 3 crore rupees is the cost of education in India. And our post graduation is not globally accepted. We cannot practice in United States as a postgraduate. Basically, our degrees are not accepted, but National Medical Commission basically is accepting the degrees or specialization from these 5 countries: United States of America, UK, Australia, Canada, and New Zealand. And now the national exit examination has been introduced in India, and those students who are in the from next year, the implementation will be there. So similarly to the United States, we are following the same system, and now national exit examination will be implemented from 2025. So that will be in step 1, and after that you will be getting the internship, and post that you will be giving the national exit examination 2, and then you will be getting the license to practice in India, or you will be eligible to apply for the post graduation. So those students who are in the foreign medical education, they will also have to give the national exit examination from next year. Foreign medical graduate examination mostly will be scrapped, and it is a very competitive examination, and profile will have its own importance in the medical education in India as well. So quality of education matters, and graduates from these 5 countries are accepted without any licensing examination in India. So new medical education system from 2023, and there is a new Mool Mantra, and major emphasis is on the clinical exposure. So those who can diagnose the patient, you can treat the patient. Theoretically, you may be scoring very good marks in all the examination and all that, but how is your clinical exposure? How you can diagnose the patient? That is the key for the success. So world over, clinical exposure is the basic parameter for getting into the education systems and for the post-graduation part. As far as the global examination scenarios are concerned, India is introducing national exit examination. Already the gazetted notification is there. USMLE, lot of changes are there. Step 2 CS has been scrapped post 2022, and now step 1 and step 2 is there. Step 2 only has a CK, clinical knowledge, and step 1 is there, which is converted into the pass and fail. And 15 to 20% of weightage is for the USMLE. Step 2 is very important because step 1 is only pass and fail. So major emphasis is on step 2, and you need to score 250 plus marks if in step 2 examination. And USMLE is all about, step 1 is all about the pathology, around 50 to 60% it is based on the pathology. Second, it is anatomy, gross anatomy, physiology, uh, then basically biostatistics, genetics, all these are the major components, biochemistry of the step 1 examination. And step 2 is all about 60% emphasis on the internal medicine, followed by the pediatrics, gynecology, surgery, and all that. So better the knowledge, better the clinical exposure, an approach is different. So basically, uh, my advice to all the students: don't rush up for giving the USMLE and all that like the previous seniors were doing, and you should have a proper planning for that. PLAB has been replaced now by the UK MLA. It will also be implemented, and Australia also has two parts. AMC is there. One is a MCQ and another is a clinical knowledge, testing your clinical knowledge. So Australian Medical Commission. So major changes are there post COVID, and everybody is putting emphasis on the clinical diagnosis. Uh, so United States basically is offering two programs. One is the see, in United States of America, medical postgraduation is the minimum qualification to practice. Undergraduates, unlike in UK and all that, you will be getting the GMC registration there if you are clearing the lab 1 and lab 2 and all that, and having necessary completing all the parameters of internships and all that. In the United States, you cannot practice with an undergraduate degree. PG is the minimum qualification, and two programs are there. One is a residency program, which is the #1 program in the world, which is through the USMLE path, and second is the physician associate program, which is I will be. This is a new thing. In most of the Indians are not aware about it, but it is a great career path ahead for the students, and they can practice in United States. Of course, it is a second most best program next to residency, but it is a pathway to reach to US without the USMLE route and to have a license to practice. So these two professions can treat the patient in United States. So in brief, first I will be covering the physician associate program, and those students basically you can go to the aapa.org site. You can take the screenshot for this. This is the government website where you will be getting the complete information about authentic information about the program, www.aapa.org. So this program is typically for 2 to 3 years duration is there, with almost all the specializations available, right from pediatrics, internal medicine, emergency medicine, surgery, orthopedic surgery, neurology, all the specializations are available. And typically the 24 months to 27 months of program, and around 175 universities are offering this program. So currently this profession was established in United States in 1967. Currently approximately 1,68,300 physician associates are working in United States, and with more than 500 million patient interaction per year. So primary healthcare in United States is mostly handled by the physician associates. They are doing all type of diagnosis. They are doing prescribing the medication. They are evaluating the patient and all that, giving the prognosis. Everything is handled, even doing the minor surgeries and all that. So around 260 programs are there. 175 universities are giving this program to the international medical graduates. Very, very competitive admissions. Around 2,000 hours of clinical rotations. It is a typically master's degree available. And post completion of physician associate, you will be giving PANSE examination, Physician Associate National Certification Examination. This is a licensing examination for the physician associates with more than 95% of passing rate. And post that, you will be getting the state, after completing the state criteria. Each state has their own policies. So you will be getting the license to practice in the United States. Mostly 35.4% of are working in the hospital scenario. It is a second, as per the US business reports, It is the second best healthcare job in United States, profession in United States after the residency. So 35.4 hospital, they are working in hospital scenario, 5.2 in the urgent care centers, 7.2 in other, and 52.2 in the outpatient clinics. Basically, 21% in the primary care, 12.2% in internal medicine subspecialties, 8.4% in emergency medicine, 1.5 in pediatric subspecialties, 30.5 in other specialties, 26.4 in surgical subspecialties. So a duration is 24 months to 36 months. Around 175 universities will be providing best topmost and non-capped H1B visas are available for the physician associates. It is a paid program. It is not a free program, unlike this residency. So basically, the salaries for the physician associates are around 1,25,000 to 2 lakh per year. Post having the license and joining the jobs, you will be getting at around 1.25 to 2 lakh dollars per year. Salaries are there. You basically, what are the criteria? So first, you will have to do the WES evaluation. So if you are an MBBS graduate, even the students, in United States, even the engineer can become a doctor, or architect can become a doctor, or humanities graduate can also become a doctor. So don't, it is all about the multidisciplinary approach in the education. It is all about the credit system. It is a credit system based. Anybody can change his career in United States. So don't have this impression that some program is inferior, and why the biology students or Ayurveda students or physiotherapy students can also pursue the physician associate program. They can also pursue MD program. That is not an issue. David Kaufman, the #1 infection specialist in the United States, in the New Jersey area, he is a humanities graduate first, and then he did his residency program. So it is the flexibility into the system. Even the doctors are doing the managed MBA programs there. It is all about a multidisciplinary approach in the education. So physician associate, you will be doing the WES evaluation. Your Indian credits will be converted, will be compared with the US credits, and your Indian percentage will be converted into the US GPA. And you will have to do the basically complete the prerequisites. Around 32 credits you will have to do from the accredited US universities. You can do it in an online mode. So students who are pursuing MBBS or already have a degree, even the BDS, BHMS, physiotherapy, occupational therapy, they all can practice allopathy in United States. They all can practice this. Those seniors who are facing a lot of difficulty because of the gap in education, but having the dream to go to the United States, this can be a most preferred pathway to enter into the United States. Biomedical, biotechnology, bioinformatics, all these students can pursue this. So these are the 9 subjects which you will be doing the prerequisites: anatomy, physiology, biochemistry, microbiology, chemistry, organic chemistry, genetics, medical terminology, psychology, statistics, and healthcare experiences. So around 32 credits are there, and you will be giving the GRE examination and TOEFL examination. In GRE, in prerequisites, you should score around 3.5 GPA. In GRE, around 300 marks, 300 plus marks. TOEFL, you need to score around 100 plus marks. Then 2 examination post completion of your prerequisite is CASPER and PA-CAT. So CASPER is testing your basically it is based on the medical ethics part. There's behavioral tendencies of the applicants, and PA-CAT is an evidence-based assessment of the academic preparedness, which is based on your prerequisite part. So GRE is a very common examination for everyone. Even the humanities students, commerce students, everybody is giving this GRE examination. WES evaluation is necessary. So these are the popular branches available: family medicine, internal medicine, pediatrics for the physician associate, cardiology, critical care, endocrinology, gastroenterology, hematology, infectious disease, nephrology, neurology, pulmonology, rheumatology. then obstetrics and gynecology, ophthalmology, psychiatry, radiology, pain management, dermat, genetics, cardiovascular, pediatric, all about transplant surgery, everything is available for. And those students who have done their MBBS and all that, or those students in the foreign medicals also, which are who are facing huge problem to enter into the India, they can also take up the physician associate program. So post physician associate, you can do the PhDs also. You can simultaneously build up your profile in the research, you the USMLE side by side, and with a license to practice and a job security in United States, then you can also pursue the dream of residency, because already you will be having a exposure in United States, clinical exposure in United States. So that is a great option for you, and very, very prestigious job, very highest growing job in United States. Of course, after the residency. So what are the highlights of this program? Amongst the 3 top professions in the United States, very high job opportunities, non-capped H-1B visa, is speedier green card processing, curriculum practical trainings, means during your masters, you can work on a curriculum practical training. They will be giving you the I-20 form for CPT, and you will be earning your living. And post completion of your masters, you will be having a 3 years of optional practical training, where you will be working with the professional organizations and on the salaries as per the US laws, and they will be giving you sponsoring you the H-1B visas. Very prestigious job, and around 2 lakh dollars now it has been increased, and prerequisites can be completed in an online mode from India. Means for my accredited universities of US, you can do it from India, and you can also complete this path by in an offline mode for on a F1 visa from the United States universities. Integrated programs are also there, where directly after 12th or even after MBBS or any degrees, you can directly fly down to United States for 5 years, and you can have an integrated program where you will be doing all these prerequisites, everything in the United States, and you will be having a direct transfer to the PA program, and then you will have the license to practice. So this is there. Lot of scholarship and education loans are available. If you have some relative in United States, you can get an education loan at a very cheaper rate as compared to India. Secondly, lot of scholarships are based on your academic profile, non-academic profile, and your analytical ability. So based on that, students are getting huge scholarships there, and you can also do the research assistantship, teacher assistantship, or in-state, out-state scholarships are also available for the students. So great program. Please keep muted.
Please don't disturb. Please don't disturb.
Scholarships and educational loans are available for the students, and every great program. Very competitive. Each program has only 30 to 35 seats are there. So a lot of international applications are coming for this program. So we don't represent any university. So basically we need to match the profile of the candidate. We have to build up the profile of the candidate, and then we need to match it and shortlist the universities. PA interviews is an integral part for this. So the admission committee will be conducting the PA interview part also. So overall a great program. So you have you can take a 1 year full time prerequisites programs in India in an accredited mode. Second is those who are into the graduation, they can start right from the second year, third year. They can plan their PG, and they can take the prerequisites while doing the college in India, so that they will save the time. And third is you can directly go for an integrated program. Even after 12th, we can send a student for 6 years program in the United States, where they can have after 6 years license to practice as a physician associate in United States. So overall great program. Deadlines. So basically 3 admission cycles are there: January, March, and August. So based on your parameters completion, you can target the next cycle. Now residency program. This is of course the most prestigious program and dream of all the medical professionals. So number 1 program, very competitive program. Lot of changes are happening in the admission process in the United States. All the parameters are totally changed now. Lot of new strategies has to be implemented for getting a successful admit in the residency. It is a free program. Physician associate program is a paid program with around $30,000 to $50,000 per annum is the fees for the physician associate program. But and prerequisite cost is at around $400 per credit. As far as residencies program, it is a totally free program with around $4,000 to $10,000 per month stipends are there for the residency candidates. Lowest qualification to practice in United States, basically. And as per the latest match results, around 2,000 seats were vacant. Even the seats were vacant in the surgical and clinical branches because of the lack of strategic approach. People are not aware about how to handle the admission process. What are the criteria where they should apply? Not every student can go to the AIMS and ZIPMERS like or AFMC like institutions. You should have a match. You need to match your profile. That's why it is called as a match process. पत्रिका जोड़ना जुड़ना उसको ही मैच कहते हैं. So basically it is all about how you are matching your profile. What are the chances? What are the parameters you need to cover up? So even the surgical branches are available. Now USMLE has its own importance. Step 2 has a lot of importance. Step 1 is only pass and fail. So with decent patient exposure only you should try that. Lot of students are giving it in the third year USMLE step 1 or before having a decent patient exposure they are giving it. So now the basically as far as the admit proportion is concerned, 10 to 25% importance of USMLE is there. From 2026, 26 January 2022, lot of changes are there. And USMLE is now only a pass and fail in step 1 examination. Previously, it was a merit-based examination, but now step 1 is only pass and fail. And major emphasis is on the step 2 CK. So scoring good marks into that is really very important. Now there are 6 different pathways to get a ECFMG certification. Without ECFMG certification, Educational Commission for Foreign Medical Graduates, you cannot get into the residency eligibility certificate. So this pathway is most important for the foreign medical graduates also. Lot of Indian students are messed up in the stuck up in the Russia, Ukraine like countries, and with the new education policy and new criteria for the foreign medical graduates to enter into the India gazetted notification. Now every student, if they are even your siblings, if they are planning to go to the foreign countries for medical education, you should be aware about this. So what is pathway 1? All the Indian students will come under the pathway 1, where now because CS has been scrapped. So now pathway has been introduced. So already the license to practice in another country is pathway 1. So Indian students will come under this. But the students who are in the foreign medical education institutions, they should first see that whether their college is there, or before taking the admission, you should check whether your college is in the pathway 3 or not. So what is this pathway 3? So pathway 3 is medical school accredited by the agency, recognized by Federation for Medical Education. In that case, it is not necessary to have the license to practice in another country. And based on your degree, you can go give the USMLE step 1, step 2 and apply for the ECFMG certification through the pathway 3. But if your college is not in the pathway 3, in that case, license to practice is necessary. So the students who are stuck up in the countries who are not issuing the license to practice, they are facing a major problem because they are not able to come to India, or they are not able to pursue the PG because of the cost of education. Even if they are allowed, they are facing major cost because most of the states are not allowing the domicile state for the foreign medical graduate. So please check up whether your college is there in the pathway 3. So please check it up for the foreign medical graduates. In that case, you can ask your institution to register for this. So these are the You go to the ecfmg.org. All these details are given there. So go through these 6 pathways and all that. How to apply for this. So basically, USMLE statement now pass and fail. Most difficult exam for Indians actually, because you are not planning it well. So my special advice to the students who are planning it, download the nbme.org. First, give some diagnostic tools are available where you can check up your knowledge, your level of your current performance, evaluate your do some analytics of your performance, and then try for the USMLE examination. Because ultimately is a basic knowledge. Based on this, you will be scoring more marks, or your performance will be for the step 2 and all that. This is a basic thing. Fundamentals are there. So always for step 1 and step 2 also, don't rush up, because failing the examination is a black spot in your profile. And getting to less marks in step 2, you will be stuck up for the 7 years. You cannot repeat the examination for 7 years if you clear the examination with lower marks. So this year, what are the observation? I will be covering up that in 2024 match results in the March, declared in March 2018, 2024. I will be giving the criteria. So basically, always give with proper planning USMLE, and by proper analysis of your performance in the mock test. Step 2 CS has been scrapped now for the students. So for getting ECFMG certification, 3 things are necessary. One is the medical examination criteria, which will be coming through the USMLE step 1 and step 2. Another is communication is very, very important. So those students who are from the rural area or from the such areas where their English is not good, so they will face a major problem. So you need to work on your communication skills. Lot of students are not getting the residency admit because of the lack of communication skills. Very, very important. So OET examination is there for that. And the third is for your clinical skill and all that, pathway is there. They have introduced the pathways now. So all these 3 things are very, very important to get the ECFMG certification. Now step 2 CS has been scrapped. CK marks are very, very important for Indian students. They are having a very good, this is the strong point of Indian students. You can score 250 plus marks in the USMLE easily with proper planning and all that. Now, those, as I covered earlier, lot of countries who are not issuing the license to practice, they are facing major problems. Like Philippines, many students are in Philippines, but in the Philippines, they were not having the reciprocal arrangement with the MBBS students for licensing, issuing the licenses. So now they are stuck up. They are not in. So their college should be in pathway 3. If their college is in pathway 3, they can go for the residency program. So never appear for any of the step 2 CK before having a decent internship experience. That is a guideline for all the students. Give the mock test, full length test. USMLE step 1 also, you give the diagnostic test first, evaluate your marks, and then give the full length mock test, and then attempt the USMLE step 1. Probably with decent patient exposure, or at least after 6 months completion of your internship, then you give that. Now, hospital rotations. What happened during the COVID? They accepted the virtual clinical rotations were also accepted in United States because of the COVID. But this year, during the match, and the students who were having a physical clinical rotation experience in United States, they were preferred over the others. So try to take during your medical education. Now profile has got 80 to 85% importance, and hospital rotations, physical clinical rotations in United States is very, very important. And not for 1 month or 2 months of observership and all that. You clear the step 1 so that chances of getting the hands-on training will be there in the United States. and do it for at least 3 to 4 months. So that will give you a great letter of recommendations also. So it is not about purchasing the letter of recommendation. It is all about from where you are taking the letter of recommendation, which senior guides are giving you the letter of recommendation. It is all about the seniority. Even if you are working in a small clinic, but that doctor is having a 30 years of experience, his opinion will have, his recommendation will have a great value in the US residency process. So the letter of recommendation and planning of the hospital rotations is key for the success. You should plan it at least a year ahead or 6 months ahead. It is not an emergency thing. And secondly, you can take some virtual clinical rotation as a combination for that. During your MBBS and all that, and before giving step 1 and all that, you take us at least 4 weeks of virtual clinical rotation. So that will also give you a letter of recommendation, and it will enhance your profile. So it is great. Now, profiling is most critical. Profiling is most critical thing as far as the residency admissions are concerned. Step 1 is a 300 mark paper, 194 is passing, it is a pass and fail. Step 2, 300 marks paper, 209 is the passing, but 250 plus marks is targeted. And after giving step 1 and step 2, then for having the license and all that, you need to clear the step 3 examination. The professionals who have passed their MBBS in 2015, 2017, 2000, a long back, it is a genuine advice for them to work on their profile rigorously, have enough exposure of United States clinical practices, and pass all the 3 examinations. Then some chances will be there. Yesterday, I was having one profile where that lady was having the MS degree in India, and she cleared almost all the 3 steps. Her step 2 score was 263. But because of the gap in the education, long gap in the education, she could not get a match this year in 2000 latest declared results. So this is my genuine advice for all the seniors who are here and having the dream to pursue the residency. Either go for a physician associate program, or if you are a postgraduate, you can think about the PhD programs also to enter there and enter into the research and all that. Or if you are dreaming of residency, so a PA program can enhance your chances, or you clear all the 3 steps, build up your profile, and then try for this. Or otherwise, you can also try for the long-term fellowship programs. So mentoring and this academic and non-academic profile has 80 to 85% weightage as far as the interview calls are concerned. So research is an integral part of US education system. So how many research you are having? It is observed that peer certified or this research has been preferred over the non-peer. So do decent research projects, have some publications, social and environmental projects. The students can join the Rotaract like clubs. They can get into the activities like plantation or organizing the health camps for the underprivileged. They can work for the drug abuse, AIDS awareness, for the juvenile diabetes, organizing a lot of stress management workshops for the patients and all that. You should create your digital CV for this. You should have your for each and activity small. You should create a 2 minutes of videos. You should attend lot of conferences along with research on pathology, on various subjects. Lot of conferences are going on. You should attend that conferences. And what is your learning? You record that. You should assist doctors other than the colleges and all that. And you should write down what is your, if you want to go for surgery or you are planning for, so with a pediatrician, what is your experience? What are your observations? How many cases have you assisted? What are your observations for the day? What are your learnings for the day? So you have to create a great profile for yourself. Then letter of recommendations, physical clinical rotation, virtual clinical rotations, review articles. It is it is the core for getting the US admits. Then writing the essays, good communication skills, writing the essays. So this year, this has been observed. Those students got the interview calls. Those who were having the great research profile with good publications, uh, uh, great letter of recommendation with a physical clinical rotation in United States, good step 2 CK scores, and good profiles, academic and non-academic profiles. So this is a critical part about getting the residency interview calls. And then, of course, the program selection, proper documentation, choosing the programs, and then applying for the multiple programs. And then match and soap. The match and soap is the most critical area. Those who designed this process, he is a Nobel laureate. And around 52 parameters are there based on which the match happens in United States. So it is a very basically complex process to understand that. And this year, around 58.5% of international medical graduates got the residency admits. So I will be showing the graphs for this. So profile built up is the key for this. Focus on that. Start early preparation. Don't rush up for the residency process. So now those who are planning for 2025, they should send their profiles for evaluation and plan the activity in a proper manner. Don't go for any malpractices and all that. And those who are for 26 match, they should start right from this, that they can have the multiple publications and all that, and great profile to compete, to sustain the competition in United States. So basically, the university, after the ECFMG certification, completion of that, you will be completing the examinations, OET examination, applying through the pathways, getting the certification. Then you will register for the ERAS process. Then you will write down the statement of purpose, ERAS essays. That is very crucial document. And then shortlisting of the programs, applying for the ERAS. The university, based on your profile, will be shortlisting the candidates and calling for the interviews. And after the interviews, you will be preparing your rank order list and they will be preparing their rank order list. So the prepare in the strategic way, the rank order list is very crucial, which is handled by the experts for. They should, a lot of experience is there with the faculties and all that who guide for that process. They are experts for that. And then match and the supplemental optional spot rounds, that is called the SOAP round. So match basically R3 processes there. One is register, then rank order list, and then receive the match results. This is the R3 process. These are the statistics for last 3 years. This is all available on nrmp.org. You should read each and every minute details, and don't go on any of the forums like Google and all that. For authentic information, always go to the authentic website. So this is the position for 2022, 23 and 24. In 2023, approximately 42,000 applicants were there. Around for just a minute. And around 93.9% students for 39,205 total positions, around 42,549 applications were there. So 93.9% students got the residency match that year. And around, as far as international non-US citizen, 4 type of categories are there. MD seniors who are the passed out from the US. Second is doctor of osteopathy candidates. That is another commodity. Then the US citizens but international medical graduates. And fourth category is non-US citizens but international medical graduates. So basically, this ratio increased as far as 2023 match is concerned. So 42,952 certified applicants were there for 40,375 total positions. See the ratio as compared to India. In India, around 70,000 seats for clinical, non-clinical branches and total 2,50,000, 2,60,000 students applying. 0 percentile was the eligibility last year. And still the seats were vacant because of the cost of education. And here, 59.94% students, non-US citizen immigrant, international medical graduates got the match. Now, this is the latest. So this year, around 44,853 certified applicants were there. So 4.4% increase since 2023. This much of the applicants increased, and 2.8% seats were also increased at around 41,500 something is there for positions were there. So this year around 58.5% students got the match. International medical graduates. Total positions were 93.5% were filled for the postgraduate first year. So great results. Around 60% success for the international medical graduates is the great average. So this is a calendar for the 2025. So generally March 17, everything is given. So you go on the ecfmg.org for all this information is given there. For the match calendar and everything, you download this thing on ecfmg.org. So surgical and clinical branches are also available for the students. It is a false information created by the forums. It is not available. I will show the direct results to you. So these are all the data available in 2023 as far as placements are concerned. Non-US citizens got 62.4% placement and match were 59.4% were the match. So great. Overall, the great ratios are there. All these graphs are available. Now, this is a 10 years of data right from 2005 to 2024. This is a data available for the students. So you will see, please keep yourself muted. Somebody is. So in 2022, 4,406. Please, Pranali, mute everybody, please. Pranali, Varshaji, please mute everybody. So 2023, 4,933 matched students got the match. And this year, 2024, 5,742 students got the match. This is the complete data.
2024 data. Can you just scroll down?
This one. Just a minute. Now you are able to see this?
Not for 2024 year. It shows up till 2023 only.
No, I am able to see this. But why you are not able to see? I don't know. But this is in 2024, 58.8% is the ratio, and 5,742 positions were filled by. As compared, around 900 more positions were secured by as compared to 2023, secured by the international medical graduates. So to sum up, don't rush up for USMLE, prepare, build up great profile, have good letter of recommendations, have good, excellent clinical exposure in United States, have good publications, attend multiple conferences and all that, and score good marks in step 2 CK. Don't give the examination unless and until you are confident and your mock test results are up to the mark. So students can start early. Those parents who have joined, they can plan. See, you need to plan financially also. Because in India, you will be covering UG expenses plus PG expenses. So if you are summing up all this, so for 10 years, the average cost for the parent is, I don't know, at around 75 lakhs to 1.25 crores for the UG part. And for the PG part, it is anyway between 50 lakhs for non-clinical branches. Clinical branches are 1 crore and above till 2.5 crores. So total cost of education is very high. And then after that, you will be requiring money to invest in India for the businesses. So, and again, it is not a globally accepted PG. Lot of new technology enhancements will be there. Lot of research is happening in the world. So you should have a updated knowledge. I am not saying that Indian knowledge is inferior, but always we are still to match the US standards. We don't have the global acceptance. So you need to plan early so that from the second year, third year onwards, you should plan the profile built up activities, preparations, everything, rotations, everything. And when you have time in your hand, your profile is definitely. It is all about planning. So for the foreign medical graduates or even for the Indian students who are pursuing the degree from the new medical colleges, please check out for this sponsor us note on vidons.org for the whether their college is listed into that, and go on the sponsorer note to check whether their college is there or not. That is the essential criteria for this. Even for PLAB or even for any of this, even if you are planning for the United Kingdom, your college should be listed in the World Federation for Medical Education. So please check out with the sponsor's note and all that. So all these are the expenses for the step 1 and step 2. You can go on USMLE.org. I will not speak much about this. Now, these are the exact number of specializations which this year non-US citizens preferred or they were matched for this. So, top 5 branches were internal medicine, emergency medicine, pediatrics, neurology. There and many students got the surgery branches also. Okay. So basically, you will see that 231 students. So categorical and primary and categorical. So basically, a lot of students got the categorical positions in this surgeries and all that. So international graduates have secured the preliminary position PGY1. Preliminary 545 international medical graduates got. Basically, unfilled were 549 seats were unfilled, and 200 students got the surgical seat. Means 549 seats were vacant for surgery in United States. So preliminary means they will observe you for 1 year and then they will transfer you for the category in the second year. Mostly for surgery it is there. They will observe your skills and all that. In plastic surgery, around 185 students got, international medical graduates got the position. 12 positions were vacant. Pediatric anesthesiology, around 500 international medical graduates got the match. 251 were the vacant positions. So all these data are available. This is a PGY2 positions. Means if you entered into the residency, and again for the postgraduate 2 positions you applied for the vacant spots available. So 162 patient student got that positions. Around 6,054 total student international medical non-US international medical graduates secured the admission for this. These are the complete data available with us. If you are planning to send your child post 12th, after 12th for the residency program, it should be the number 1 choice because directly accepted in India and globally accepted. So what is the pathway? It is not for everybody. Everybody are learned here, but still I am telling for the parents who have the second child and they can plan for this. So I am covering in a broader community here. So basically, international medical graduates, they will do the pre-medical. After that, they will give the MCAT examination, and either they will go for MD or Doctor of Osteopathy program. And then after that, they will give the USMLE or complex examination, and then they will secure the residency exam. or they can go for directly for the integrated pre-medical and PA program, physician associate program. In 6 years, they can become the clinicians there in United States. This is a pathway there. You should always get your academic credentials verified through the EPIC. This is a special provision on the ECFMG portal. You go on the EPIC, you open your account, and you should get it verified. Early verification of your transcripts and all your academic records will save lot of time, and you will be able to plan accordingly. That's why open up your account in the EPIC portal and do that. These are the 5 websites. Each and every professional or doctor should go through it thoroughly. So www.nrmp.org or ecfmg.org, usmle.org, nbme.org, National Medical Commission ka nmc.org.in, and aapa.org for the Physician Associate Program. So this is the most authentic information. Even I am sharing the information after going through all this and all that, and we are always into that. So basically, every professional will be, if you have a good information, nobody will be in a position to cheat you actually. So then you will be in a position to take proper decisions based on all the past data, all the research, what are the new developments with the proper guidance. So go on this websites, read each and every bulletin. If you want to have, our offices are there. We can have a online connectivity. We can have a online appointments, one-to-one appointments for counseling sessions for that. So for one counseling session, we are not charging anything for you. So you can take a screenshot for this. Our websites are there. AstuteAcademy.com, AstuteCareers.com, AstutePromo.com is our YouTube channel. Our offices are there in Mumbai, Pune, Nagpur, Akola, Jabalpur, Kolhapur regions. So you can surely connect, and Vadodara also we have the office. So we can have an online meeting through the Zoom or all that, and then you can share your profiles. We can plan accordingly. So how we help? So basically, we are not teachers. We don't teach you USMLE. We mentor you for the USMLE. Plus, we mentor you for the residency program. We handle the complete academic and non-academic profile built up. We suggest you after we provide you the diagnostic test. We evaluate your complete results. Then we have a complete team of academicians from the United States who will be guiding you for the monthly and quarterly activities, academic and non-academic activities. They will be giving you guidance regarding which research projects you should take up, regarding the data availability, regarding about the article, editing the article, regarding the publication. We will be helping you with that. We will be helping you with the clinical rotations in United States, planning of letter of recommendation, then complete visa process and everything, ECFMG certification, ERAS application, shortlisting of universities, then interview trainings by the Donald Martin like people, ex-deans, and then handling of complete NRMP, ERAS and NRMP process, match and so strategically. So basically, we will be suggesting you certain materials for USMLE, providing you the evaluating your results from time to time, planning of scheduling of that. It is very, very important criteria, and overall profile built up and strategic and analytical approach for the admissions with help for the research as well as for the rotations and everything. We will be guiding you for the ERAS, essays, everything for 2 specializations at a time. So all this thing, early planning is must. Don't be in confusion. And basically, if you want to connect with me, you can surely connect by one-to-one appointment. So I feel that's the complete information I shared with you. I hope it was informative. I tried to give my best. You can also suggest me how to improve, how we can improve on this. We are open for the good suggestions for our self-growth. So now we can take the questions also. If you have any questions, you can write down.
Helpline number is shared actually. Helpline number is shared in the chat box. Anyone who
Okay.
can ask anything on this number. You can WhatsApp also, you can call also. In the chat, the number is given.
Namrata, see, as far as Canada is concerned, Canada is presently open only for the permanent who are having the PR there. So first you should have a PR there in Canada, and then you can try for all the there. Yeah. So profile built up is necessary for that, basically. So for me, going to the United States is a better option because ultimately you will be having a, access to the Canadian system. And presently, our relations with Canada are also quite strained. So it is always better if you have a PR, so you will have to clear their clinical and examinations and all that, and work on your profile. And then similar, it is quite similar to the US system there. So yeah, questions. So you share. Do you do one thing? You share your complete profile with us from where you. So please share your profile so that we can evaluate why you could not match in the United States. So basically, we will evaluate and then we will give certain inputs what can be done and we can plan your next match now. So please, unless and until we evaluate your profile, making any comment is not a responsible thing. So please share it with us. Uh, any questions? Chat. Yes. Uh, what are the opportunities for me for US? I have two kids, 14 years and 12 years. Husband is architect, MTech, town and country planning in government job. Okay. Madam, for you, first of all, you should share your profile. That is first thing. Then I can suggest you. But as far as your residency is concerned, uh, it is really difficult to get into the residency program. Still, if you wish, so you should give the step 1, step 2, step 3, all the steps. You should clear that, build up your profile, have some research done and publications and all that. Take some clinical exposure in United States and try for the residency match. But the best way to go into the United States will be the Master of Physician Associate program. In that case, you can surely enter into the United States and you complete your prerequisites in India, and you can pursue your as your children are also grown up, so they can also come with you on a dependent visa in United States, and they can plan their further education there. But physician associate is a more feasible pathway for you, and that is without USMLE route, and you complete that so that your profile will also become strong. You will have a financial backup because of the jobs and everything, very prestigious jobs, and do the physician associate license. Simultaneously, you work on your profile also. In the future, you can think about the residence. Sir, I am pursuing my first year in the PG Bible in India. Yes. So if your education is in continuation, see, if anybody completes his MBBS in 2021 and immediately he joins the PG course for 3 years, so that will be taken up into the consideration because no gap is there. So you can surely start building up your profile and work on the USMLE and all that. Take virtual clinical rotations. After clearing step 1, go to the United States for that. So you can surely plan for the your PG program, residency program in United States. But if you clear your PG by in India, then you are into the job and you are wasting your 4 5 years in India, and then thinking of US going to the residency, it will be a difficult proposition for you. So don't do that. Uh, is addition needed for step 1? Okay. Dr. Nimish, please share your profile, what research you have done, and what are the publications and all that. Please share that, and we will comment on that. Having a multiple having the multiple research is always a great thing. Even in India, with a national exit examination, this profile system will be implemented in India also. Payment seat options in India for clinicals, please. Yes, payment seats are always available. So 50% of the, see, in private institution, 50% seat will be for the state government and 50% seats will be for the management quota. Out of the 50% management quota, 15% seats will be for the NRI quota. So the and in deemed universities, 50% will be for the all India quota and 50% for the management. Out of the 50% of the management, total 15% is for the NRI. So basically, the cost of education, if you are affordable, so the student can apply, Indian student can apply to the All India quota in government as well as state quota in the government colleges. He can apply to the management quota in the private institution, or he can apply for the state quota in the private institution. He can apply for the deemed universities in on India quota, and he can also apply for the management seats in the deemed universities. All these options are available. Plus, you can apply to such states where non-domicile seats are available for the post graduation. So you can also apply into that. Mostly management quota will be available there. So if you have a good provision of finances, then go for this. You can go for this. So it is all about money. And no need to give donations. No need to go into the malpractices. Everything happens with proper strategies and on the merit. Everything happens with the government regulation. I cannot. USA resident, international medical graduate. What is your question? Hello, sir. I've shared CV with. Okay, thank you. Thank you. USA. Who is this? USA resident. Huh. USA resident is there. You are if you have a resident permit in United States. Basically, in that, what is your question? Option as a visa required. A better option as visa required. No, in that case, you will not require for residency. You will be having a J1 or H1B visa for the international medical graduates. Even in United States, if you are a resident, so for international medical graduates, they will be going, and for those who are not having the US residency or this green card there or long-term visa there, so they will be going on a F1 visa for a PA program, or they will be going on a J1 visa or for the residency, J1 or H1B visas. So, Aruja Adhar, please have a one-to-one. You share your profile first, then we can surely connect with Varsha or Pranali. We can schedule one-to-one appointment, and then we can speak in details. I will evaluate that, and we will share your profile with the US team. We will take a comment from the US team, the experts, and then we can give you certain areas where we need to work on your profile and what can be the exact plan for you. So we can have a customized planning, Aruja, for you. But for that, please share your profile. Having 2 years of gap after MBBS is not a problem. It should not be more than 5 years of time. So you can surely think about 2025 match, Shailu, or you can surely think about 2026 match also. So having completed 2 years of MBBS is not a problem. It should not be more than 5 years. Directly or join PG and then try USMLE after completion. See, one thing for sure. If even if in India you are doing the PG, if you are not going to the government institution, you are not getting the government institution, what will be the cost of education? You think about this. You think of, otherwise you will be going for a DNB programs or postgraduate diploma programs and all that. or non-clinical branches for the, if you are a mid-level student. If you are an excellent student, then you can compete for the Indian positions in the government colleges and get a subsidized education. But what if you are not successful? Then what is the cost of education? Then USA is a totally free program. If even if you are making the expense of say 20 lakhs, 25 lakhs, 30 lakhs for your anything required to that, flying to US, rotations, research, everything you will be getting from your stipend from United States. So it will be a zero budget education, and plus global acceptability of that. So it all depends. If you have a great profile, then surely you should think about the US, and we can work on your profile also. So money, lot of options are there. You can discuss. We can. This is a very personal thing. Financial budget is it cannot be discussed publicly. So we can have one-to-one session for the financial. Are scholarships available, sir? Yes. For which program you are asking? As far as residency, Shailu, for a residency program is a free program. So there is no, it is a federal government funded program. Physician associate program, lot of scholarships are available. Uh, uh, Unlike any other master's program in United States, it is based on the quality of your application. Residency is a free program. There is no need of scholarships for that. It is a totally free program. Yeah. Any other questions are there? Anybody can ask also. Any other questions are there? You can surely ask those who are here. Just a minute. One more message is there. Thanks. Okay. For residency, sir, for travel and exam expenses. No, you should take one sponsorer. A lot of organizations like see RSS like organizations, or some big corporate companies like Wipro and all that and all that. Lot of sponsors are there who can have sponsor you. You can connect with certain NGOs if you really don't have money. So a lot of NGOs are there who can like Morarji Mills and all that. So who can fund your for an education, or can give certain scholarships for the your this part for traveling and everything. Even the Maharashtra government or many state governments have the scholarships for the uh, SC, ST, and OBCs and all that for the foreign educations. So you can surely try for that. You what all should be shared in the profile? Just make your CV, write from your all your education and all your academic and non-academic activities, research and everything, from where you had done your 10th, from 12th, then MBBS first year, second year, third year, fourth year, fifth year. What was your overall percentage? What activities, academic and non-academic, you had done? Your family background. So you should, what your hobbies, everything you mentioned there. Any specific achievements, you can also mention that. Okay. So that's all. I think all the questions are answered. So wishing you all the best. Hope to connect you again. We have also formed the community, WhatsApp community for this. So we will be sharing the link with you, and you can surely join and that community for the latest informations. Uh, Plan your career properly. Don't be emotional. Take a practical decisions. Lot of options are available for you, and we will surely help you with that. Yeah, Karuna, a lot of scholarships are available for the PA program also. So basically, in USA, three parameters are there. 50% weightage is for your academic profile. Academic profile means what is your percentage of marks, what research have you done, whether you have some publications and all that. Second is 25% weightages, or you will be covering the prerequisites for the PA. So you should score good marks in prerequisites. Around 3.5 GPA is easily achievable for the MBBS students, because already you are aware about anatomy, physiology like subjects, and it is an easy pathway for you. So it is based on that. Secondly, you try to get good marks in GRE, around 300% TOEFL, to write good essays and give good interviews. So based on that, this scholarship is there. Second is, when you go into the United States, see, in US, everything is credit based. Secondly, every student has a different fee structure. In Massachusetts Institute of Technology, which is a #1 institute in the world, around 85% students are taking free education. Why? It is based on, because a lot of scholarships are available for you. So in PA program also, you can do the research assistantship. Means while doing the PA, you can assist your professors with the research. They will be based on that, they can give you certain scholarship. Or teacher assistantship is there. You are participating and assisting the teachers for multiple projects, corporate and hospital level, corporate level projects, international projects, and they can, because of their recommendation, you can get financial assistance. Dean scholarships are also available based on your performance. So a lot of scholarships are there. See, after all, it is not a concept that you should spend your parents' money for the education. At this age of time, you should take the risk of taking financial loan from the bank and try to get scholarship, and you repay the complete loan for your undergraduation as well as your postgraduate from your salaries from the United States. So you should repay it. Even in India, you will be pursuing your PG and spending crores of rupees and then doing the job of 1 lakh rupees or 60,000 rupees with the organization. So where you will go now? So you are and then you will say, ask your parents to give the money again for investment for starting the clinic, then for marriage, everything. If you are married, it is okay. So either you will be a liability on the parents or you will be a liability on the husband. So both the things are there. So basically, it is not a concept. It is that you manage your expenses, you work on your profile, you take the education loans, and you repay it from your salaries and all that. See, amount of risk is always there in life, and calculated risk is a part and parcel of to become a successful. If I will think, I will not take any of the risk in life, I will have a limited growth into it. No risk, no gain in life. It is a fundamental. Okay, thank you very much. So that's all from mine. I hope that session was good. You can write down your comments for the session, and wish you all the best for your future. If you require certain help, we can surely connect with each other. Okay. So we can guide you for all the parameters, for research, for rotations, for complete profile built up, everything. Thank you very much. Thank you. Good night.